What is clinical handover? Well, basically it's just telling another health professional all about your client and their needs, hopefully in a logical, clear and concise way that doesn't leave out any important information. It's a really critical component of effective multidisciplinary practice, so it's a really important skill for occupational therapists to learn. It can be a bit of a tricky skill to get right. You can feel nervous, you might feel a little bit embarrassed that you're going to leave information out, but there is a framework that can help make it a little bit easier to learn. It's called the ISBAR framework, and I'm going to take you through a quick example of what it's all about right now. So ISBAR stands for Introduction, Situation, Background, Assessment, Recommendation. I'm going to run you through what you would normally cover in each of those sections and give you a super quick example of what it might look like in reality, keeping in mind that in reality there's probably a whole lot of extra detail that would go into what you're explaining to the person. Okay, so I, introduction, that's where you tell the person all about who you are, where you're calling from, and which patient you might be calling about. S, situation, this is where you talk about, in a nutshell, what is the main reason that you're calling for today? What's the issue? B is the background, so any important information that they need to know about the person for you to explain that situation, not their whole life story, just the essential details. Assessment is what you've found out so far. What have you done in terms of your own investigations or information gathering, and what are you thinking is the issue? And then recommendations is what you would like the person to actually do about it. So what do you think needs to happen, or what would you like them to do further? So now I'll give you a super quick example of what that might look like in reality. So say the situation is that you're an occupational therapist and you've just done an assessment with your client on the ward in terms of their self-care, and you need to give a handover to the nurse to give them an update in terms of how much help they need. So it might go like this. Hi Sue, it's Claire the OT from Ward 5. I'm just calling about Mrs. Jones who's in bed 26. I've just finished my shower assessment. I wanted to give you a quick update about how much help she's needing and what the plan might be for her shower tomorrow. Okay, so she's now day 4 post her total knee replacement. She's actually going quite well with the physio sessions as well. So in the shower, she only needed setup assistance from me for the shower chair and some minimal help to get on and off the shower chair and to wash and dry her legs. I have shown her some long-handled aids, which she's going to start practicing using as well. So tomorrow during her shower, can you please just encourage her to keep practicing with those aids and let her do as much as she can herself and just help where she gets stuck, and then just let me know how she goes. Thank you. So there you go. Hopefully that'll show you how the ISBAR format can make things a little bit easier. If you'd like to find out some more information about clinical handover, then check out the comments below. I'm sure I'll have some resources that I can link you to. I'll see you next time.